Welcome to Health Talk. Today's topic is going to be cybersecurity and healthcare. With us today, we have Dr. Mary Rithu. She's a doctor from India, and she's now here in America. We have Laura Billard, and we have Kevin Liu. We think this is a really interesting topic because we are all stakeholders in this topic of cybersecurity and healthcare. Number one, I'm a physician. Number two, I'm also a patient. You two in the home audience are patients, or you have to take care of loved ones who are patients. And so we're all in this together. And being in Silicon Valley, we have engineers who create these devices, the software, and cybersecurity, how to block hackers. So one of the things that was interesting to me, because I see a lot of diabetic patients, is that there are 1 million insulin pumps in America. So Dr. Rithu, you've been an internist and you see diabetic patients. Why do you think having an insulin pump is something of concern if we're thinking about cybersecurity?
Absolutely, Dr. Wu. As you said, there are a lot of diabetic patients now, and insulin pumps are one which type 1 diabetes patients use, which is they have to have access of insulin throughout their lives. So they are on these insulin pumps, which are an embedded which use the embedded computing software, which has two devices, either the insulin pump itself and the remote, which reads the patient's blood glucose and then signals the insulin pump, to automatically dispense insulin on its own terms.
So for the home audience, here you have the pump that's on your body,
yes,
and then there's another device elsewhere, and it's sending it by Bluetooth.
Yes.
So, Laura, we've discussed this off camera. So we can hack into that using Bluetooth. So if I'm in Starbucks having my decaf black coffee, no sugar because I'm diabetic, and I'm wearing my pump, what can you do to hack into it if you wanted to?
Well, as you were saying, hotspots are something you could use, and essentially you could just buy any device to create a hotspot, name it something friendly in a public place. People will connect to it, and there you have a point of entry for vulnerable technologies like this insulin pump.
So if you create a fun name like Happy Days or something, somebody could also be remote, far away on the internet, manipulating that.
Yes.
So you can even not be just 30 feet away. You could be even farther away. Tell us a little bit about that. How would you do that?
Yes, so essentially you would be using that hotspot as a proxy. And that just means that you can connect to that hotspot from far away and then hack into whatever public area you need.
So this would be a problem for diabetics in an airport, watching a football game at a stadium, or being in a place where there's a crowd and you could just have evil people. There are certain people who want to hack, and it's been listed by government websites. There are people who are called hacktivists who just like to hack, and they do it for fun, to be evil, to have power. And there are people who are criminals who want money. Like they say, I've hacked into your device, or I've hacked into all these devices, or I've hacked into the hospital computer. That happened in 2016, MedStar, Washington, D.C. area. It was spring 2016. And all these 12 hospitals were shut down. No patient records could be accessed. They couldn't get drugs for the patients. They closed the ER. And the hackers wanted money. They wanted $200,000 or some sum of money. So this is called ransomware. And that happened again in Georgia, the Midwest, and in Missouri, where they connected to 650,000 patient records, and they wanted $450,000. So it was ransomware, again 2016, into a big hospital computer. So these are criminal groups. And then there are criminal groups who take the data and then sell it to another criminal group, and they use the data, the Social Security numbers, to create false credit cards. Kevin, you were telling me that there were studies done about this, how you would hack into a large hospital system. Tell us a little bit about that.
Yeah, thanks. So in 2016, an organization called the Independent Security Evaluators based in San Diego. They did a study to test the security measures of hospitals. So what their experiment entailed was that they left 20 USB drives around hospitals to see if any employees would insert those USB drives into the computers.
So the USB drives were unlabeled.
They're unlabeled.
And they looked innocent and happy.
Exactly. And I think that was the main reason why the employees actually did insert. So out of the 20 USBs that the experimenters placed in the hospitals, 15 out of the 20 were found inserted into the hospital computers. And so
and did the employees type in their password to get authorization?
Exactly. So initially, one of the difficulties for hackers to get into the hospital systems is to get authorization. So by placing these USB drives, employees want to return these USBs. So as a result, in order to identify whose USB this was, they needed to look at the content on the USBs, and the only way they could do that is to enter the authorization, go into the computers, and once they were inside the computers, that's when the malware on the USBs infected those computers, and the hackers gained access through that.
Oh, and then they got the authorization number, so they could really infect a large hospital system. Mm-hmm. So this is very interesting. So beware of any loose USB drives hanging out. Don't type in your password anytime, unless somebody says do it. That's very interesting. And for these medical devices like insulin pumps, let's say it tells me that my blood sugar is high. Some hacker said my blood sugar is high. It beams it into me. So that means that it'll shoot in more insulin. And meanwhile, it's fakely high. It's not really high. So then what happens to the patient?
Exactly. When the hackers actually manipulate the values and fake it as high values, sometimes the insulin pump automatically detects that because it's just programmed to detect high values and dispense insulin according to the blood readings. So it actually starts dispensing insulin in a dosage which is actually not required for the patient, and this can potentially put the patient at a risk of a hypoglycemic event, which is the blood sugar going really low and the patient just goes in for a syncope and they just collapse.
So when you get too much insulin from this insulin pump that some hacker decided to just artificially create this fake number, the patient could get a deadly dose. They could faint, and they could die. Yes. Whereas high blood sugar, you cannot die, yes, but extremely low blood sugar. So people have hypothesized that this could be targeted towards people who have diabetes, leaders in public places, or big leaders in the world, or world leaders, that this would be a way of murder, of homicide. And somebody actually wrote a novel about that in the year around when Vice President Cheney was in the United States. This was when before he had his pacemaker. Somebody wrote a novel where they programmed their pacemaker and the pacemaker malfunctioned. This was actually a novel. So therefore, at that time, Vice President Cheney had his doctors take out that wireless password component when he was having the pacemaker inserted. So this is a quandary for the FDA, because obviously they want accessibility for the patient. It cannot be so hard that the patient cannot use the device, yet it has to prevent cyber hacking, cyber sabotage, and yet all these device companies are changing their softwares all the time to update it, make it better, to make it more patient responsive. So as a result, there are new FDA guidelines. However, we cannot keep up with hackers. Nobody. There's an FBI unit in Northern California devoted to cybersecurity and healthcare. And so one of the things is that the FDA has published a paper in 2017 and updated in 2018 that they want a collaborative effort among all the shareholders, meaning we are all shareholders, stakeholders in this problem of healthcare, being a physician, a patient, being a creator of a device, or software engineers who program software into the device. So whenever there's a malfunction, you have to alert the FDA. You have to tell people. You can't just go to your doctor. That's not enough. You have to tell your doctor, alert the FDA, because you want to save other people's lives. One of the other things about this whole healthcare system and cybersecurity is that not only is there ransomware that they just want money, they want to stop a hospital, there are also people who just want to hack for the fun of it, who have nothing else better to do except to sit in a dark room and say, I'm just going to crush this hospital for fun. Because they exist. I mean, look at the U.S. election that was hacked into. We don't know if people really wanted to do this, or there were other countries involved, or people just thought, oh, let me just make 18 fake Facebook websites or 18 fake blogs and see what I can do. So the power of the internet, the power of social media has made it enticing for people to get recognition, even bad recognition, and call themselves names like the Dark Force or things like that. And they were these names that were used in ransomware for these attacks in 2016 in MedStar and in the Midwest hospital community. Tell us a little bit more what you think about devices, how many there are in America, how many there are in the world. Tell us a little bit about that.
Absolutely. There are about 3 million pacemakers all around. The entire world, about 3 million people are on these pacemakers. So you kind of know how enormous this problem is. And every year, about 600,000 people are getting their pacemakers installed or reinstalled. So the problem is really magnitudely very big. So the problem is the patients actually use the pacemakers actually send signals. It actually records the patient's, the rhythm of the heart, and then it sends it to the medical facility via the patient's wireless network, or it could be their home landline, or sometimes it could be their even mobile devices. So any unauthorized user can actually hack into them and kind of manipulate the readings, and then enable these devices to send out false signals, or sometimes it can even cause battery depletion of these devices, or sometimes it can cause inappropriate shocks or pacings, thus putting the life of the patient at risk.
Also, if you're near a big magnet, it also messes up the pacemaker. So when you see the airport, it says if you're wearing a pacemaker, tell them. And it's important that people with pacemakers carry with them the code that they get with the pacemaker, so that they're flying to a foreign country. Somebody can program it for them because they can't do it correctly unless they have the code. It saves them time. There are 24-hour numbers for Medtronics and all the 60 pacemaker companies in America, but something for the home audience to know to carry that. And we created an app called the Smart Heart Card that allows you to do that, but they're all there, they're all available. You can get a bracelet to carry that with you. Now, something also is interesting, infusion pumps were also invaded for cancer patients. So it's very important that not only the most common devices such as pacemakers and insulin pumps, but also cancer infusion pumps. And it's a problem, as the home audience knows, that as technology is helping us lead better lives, we in the home audience may not know all the safety features. And it's important to at least go over those features with your physician and call the 800 number on the device. They always will explain and talk to you about all these safety features, especially about cybersecurity and are you safe. So tell us a little bit about that experiment, this company from San Diego. So what eventually happened?
Yeah, so what eventually happened with that study was that the experimenters, they were able to access the computer, they were able to access patient files. What was more alarming was that on these nurses stations, they were able to turn on, turn off these computers. They were able to turn on, turn off certain alarms. So the complications of that could be if you had a patient that's bedridden and they are not able to to get the attention of the staff without these alarms that have major consequences for the patient. And also, even more alarming was that they were able to change the vital sign numbers on these monitors.
So therefore, you would get different patient care from the doctor if you
Exactly.
changed all the vital signs, and they could potentially die because people think they're really normal, and meanwhile their vital signs are bad. Or if there are no alarms, nobody will see them if they fall out of the hospital bed. So all of this is a target of criminal activity called ransomware, and sometimes you will see it in also your home computer, where they say, please enter your bank number because you made a bank deposit, meanwhile you didn't. And instead of the usual logo of the bank, the official logo, it's some college dorm or something like that. So watch out for all this on the home computer as well. They could say, oh, your pacemaker has been recalled, please enter your password, and meanwhile it's not. It's a spam, it's a malware, it's a ransomware. They're just trying to get information from you. And you would think, well, here I am, Mrs. Lucy Smith, sitting in the middle of, Topeka, Kansas. Why do they care about me and my pacemaker? It's not really about only Mrs. Lucy Smith and the pacemaker. It is about the ability for the hackers, because they may be just trying it out, and then they may want to do a massive attack on a whole company to bring their stock down. This is what happened with St. Jude in 2016, 2017, when Muddy Waters was the company in Great Britain. It was a research firm that did Wall Street stocks, and they decided to short the stock. And so their engineers found a potential flaw in the software. Meanwhile, none of their pacemakers were ever hacked, yet they published this in the Wall Street Journal. The stock lost money, enormous sums of money in trading. They made money, Muddy Waters, and they made money for their clients, and the engineers repaired that flaw, and it showed the power of people using that to just change the stock market, for money, even to make one company's stock go down. So you never know what the motives are, why they're hacking, why they want to do this. Instead of thinking of a massive terror attack where they just bomb the World Trade Center, they could just take all the computers down, all the hospitals across America. So it's something that the FBI is working on, the FDA, and fortunately, we're still one step ahead. So we're very fortunate in America, but we are all stakeholders. It's important to point out flaws in the hospital systems, in electronic health records, to your physician, to the hospital, to call information, because they may not know. They will call their engineers to fix the flaw. So Laura, tell me, if one were to hack and you're a young millennial and you're thinking about all this stuff and you're thinking, oh, fun, I have nothing to do, I'm sitting in Starbucks drinking my latte all day, what can I do? I'll just play on it, and what can I, do about this?
Well, hacking into somebody's devices can actually also give you access to all their data, which we can collect and then sell to somebody else on the deep web. So that's actually been a huge problem in social media.
Tell home audience, what is the deep web? Deep web.
The deep web is essentially a place where people can be anonymous and exchange information that is illegal, sell things that are illegal, and sell services that are also illegal. So through the deep web, you can go ahead and sell the data of people that you've hacked, and that can be used for some ulterior motive and whatnot.
It's very interesting. When they hacked into those two hospital systems, MedStar and the Midwest, they wanted to be paid in Bitcoin. They wanted the money in Bitcoin. They didn't want cash. So that's very interesting. So that's another reason that we should all keep in touch with the Wall Street Journal, New York Times, to find out about Bitcoin, because it plays a role in the dark web. So in the dark web, if one can create a different moniker all the time, but I believe that doesn't Google, Gmail, Yahoo, they have some limitation. You can't, they actually block it now. Isn't it true? Tell us about this. Kevin or Laura, what do you think?
Well, when you go into the deep web, you're not using your traditional browser like Chrome or Safari. You're using another browser.
Like what?
Uh, well, I don't remember a browser off the top of my head.
Do you know the browser?
It's just something about an onion.
Onion?
Yes, yes.
It's an, oh, I didn't know
Because
this.
it has layers.
Yes,
Oh, it's layers. Oh, so you go into that browser, and then what happens?
Then, well, you're untraceable, really. And you can exchange information and services and products over the deep web all over the world.
Oh, and do it in Bitcoin.
Exactly, because it's an untraceable cryptocurrency.
And they have the best encryption called blockchain, which the hospital systems have been slow to embrace. They're going towards that way. It's the tightest encryption. So tell us a little bit about what you know about if you wanted to create something like that, like some blog and you're like really different and you're like in the middle of Czechoslovakia. How do you get from Czechoslovakia to here to on the web?
Well, any computer user, they have a specific IP address.
Right.
And so if you would want to hack in a different system, you wouldn't want to be using your IP address because that's traceable to yourself.
Right.
So what most people do, especially with the to go on the deep web, in order to stay anonymous, what most people do is that they use these programs that lets them use other IP addresses around the world. So instead of having their own static IP address, they use dynamic IP addresses. So every so often, their IP address will change to a different country, and using that type of resource, they are untraceable.
Oh, and then the FBI manages to find them eventually, hopefully. But I'm sure there's still many IP addresses that are very hard to trace because they keep changing.
It keeps changing.
So that means your identity. So you're like on the run. You're always changing
Exactly.
your IP address. This could be a novel. Okay, so you go in the deep web, and then you're untraceable, and you could be this person sitting in the middle of San Francisco Airport or Kennedy International, LAX, and you could be just playing, like finding ways to make money, like go and hack into people's mobile devices, mobile healthcare devices. Also, there are wearables. All the wearable devices to track your numbers and all that. And they have personal data, the wearables. So they might want to sell that to another criminal group, or just find them to sell them more things. Or another interesting thing is cybersecurity is also going to involve the Internet of Things. Like when you have somebody talking to you from Amazon or something like that, they can take all that data and send it. They can hack into that if you're 30 feet away from your house, if you're some painter that's coming to paint inside your house or something. So if you were a painter and you were really just painting the walls, but you really were a hacker, what would you do inside the house?
Well, you could probably place another one of these hotspots and just connect to everything in the house, turn on and off the lights, maybe even get into the computers. There's a lot of
Unlock the
possibilities.
doors,
Mm-hmm.
because
Exactly,
the
yes.
doors are all computerized. Unlock the doors, and then walk in and steal everything.
Yeah.
Oh, that's so exciting. Look at this. Look what we have to look forward to when we're in the Internet of Things. Also, they can look into all the security cameras.
Yes. If there are some installed in your house or around your house, they can use the security cameras to check if you're home.
Exactly. Or if you're really just weird, they can just look in your security cameras to look at you and stalk you. Like, so this would be cyber stalking and cyber internet. So let's wrap up for our home audience, cybersecurity and healthcare. So number one, we're all stakeholders. We're all involved in this problem. So if you or your loved one have a pacemaker, a wearable medical device, or uses a medical device that is wireless, check out the 800 number of the manufacturer. call them up, ask your questions, be aware, find out, go on the FDA website, find out how the FDA is protecting you. It is protecting us. It is trying to get the engineers to create encryption at several levels so that one hacking is not enough, and that the hardware embedded passwords are a thing of the past. They're going to be much more difficult. They'll be rotating, and so it's a moving target, and it's very hard to keep up with the software. That's why the FDA has invited all of us as stakeholders, as patients, as consumers, that we must, be vigilant, think about it, still wear your device. It saves lives. We believe in it. We believe in the American Heart Association, what it has done to protect pacemakers, and all the FDA, all the 60 large pacemaker companies in America, and the large diabetes insulin pump makers in America. So, but beware, be careful, know your passwords, know your little device things, that little card that they give you, and carry it with you. So thank you for joining us. If you like our show, donate to KSAR TV, KSAR TV, Saratoga, California. We're a nonprofit. We're all volunteers. And thank you very much for joining us.